Hi, everyone. Again, my name is Jennifer Williams. I'm your host for Protecting Your Heart in 2022 and beyond. Our heart is essential to our body's overall health. It helps our other organs and tissues function properly. So we must do everything we can to help keep it protected. And February marks American Heart Month. And we are so pleased to have with us today Dr. Frederic Sardari, Vice Chair of the Department of Cardiothoracic Surgery here at Cooperman Barnabas Medical Center. Dr. Sardari, hi and welcome.
Hi, thanks for having me.
We're so glad to have you today. Were you performing surgery?
Yes, actually, I just finished a bypass about a half hour ago, so just in time.
Saving lives every second of the day. So before we get started, why don't you tell us a little bit about yourself?
Sure. So I'm one of the 3 or 4 surgeons, heart surgeon at St. Barnabas, Cooperman, and I've been here for over 20 years. I perform most common types of cardiac surgery operations, bypass, valves, aneurysms, and lately focusing a little bit more on surgery for atrial fibrillation, which is a big problem nowadays.
Can you tell us, before we get started, like a little bit about AFib, since it's something that's come up?
Sure. AFib is a condition, irregular heart rate that affects millions of Americans and can cause strokes and death if it's not treated properly. And with new technology available now, there's ways to at least prevent the complication and in many cases actually cure it. So that's an area that's evolving and it's very exciting.
Something to keep out on. So like I said earlier, our heart is so important. What are some things we should look out for just to make sure that it's functioning properly?
Okay. Well, it goes back to the basics. Like for any health problems, you really need to try and lead a healthy life, which means proper diet, daily exercise, avoiding stress as much as possible, or having activities that help reduce stress. Avoid behavior that's, everybody knows are good for health and specifically heart disease, such as smoking. And beyond that, just, make sure to follow the recommendations for getting checked by a doctor and getting the appropriate screening tests.
Sure. And I know you mentioned, diet and exercise. And I know some people hear exercise and they feel like they have to do so much, like go out and run a marathon but we can keep it simple, right?
Right, exactly. There's no, the exercise level depends on your age and your, overall health, but there's no need for, hours spent at the gym doing aerobic exercises. Walking is really the basic exercise that's the most efficient. And if anybody walks an hour a day, that's really all you need to do. So it does not require crazy exercise, no.
That's good. We walk, as Dr. Sardari saw us yesterday, we go on a daily walk every day, and we saw him all over the hospital yesterday. And I said, we're circulating our blood, getting things. Yeah, we're getting it in. So it's, simple things, really can keep us healthy. Right. And so say we are feeling a little funny and a little off. What are some symptoms that we could look out for?
Sure. Symptoms for heart disease are can be tricky, but the basic ones are chest pain or chest pressure, mostly induced with exercise. So if you find that you can't do as much, or you're walking up steps, or you're walking up the hill fast, and all of a sudden now you're short of breath, or you have chest pressure and it wasn't there a few months ago, that's a warning sign. It doesn't necessarily mean it's heart disease, but it's something that should be checked by your doctor. And sometimes it can masquerade as, pain in the jaw, pain in the shoulder, in the arm. But the big thing is if it's associated with activity, that's the warning sign.
Yeah, I didn't know about your jaw. That's interesting. So what is that? That's
just, the heart. The pain from the heart is referred to, depending on the person, to different areas. So you don't feel it right exactly in the heart. You can feel it in your chest, in your back, your arms, your chin.
It's all connected.
Yeah.
And what age would you recommend we start getting screening specific just for our heart?
Sure. It depends on your family history. If you have a strong family history, and by that I mean not just because your father had a heart attack at 80 or something, but something stronger than that, with multiple family members and early in their 40s or 50s had either stroke or heart disease. That's a strong family history. For those people, probably earlier, probably closer to 40 is the time to get the screening test, stress test, EKG, blood work, and you'll see your doctor. Somebody who doesn't have that, usually closer to 50 or 55.
And should we be going specifically to a cardiologist or just going just regular checkups with our doctor?
No, the primary doctor is the one that can get the process started. The test can be done, ordered by the primary doctor, and they're checked by a cardiologist. And if it's positive, if there's something worrisome, then you refer to the cardiologist.
Okay. And, we always stress the importance on our Facebook Lives of going for your annual checkups and getting your screenings and going to see your doctor. So if you are in need of a doctor, we'll pin the link in the comments. So it's rwjbh.org/doctor. So you can find, all of our doctors here that can help you out and make sure that you're, doing everything, taking all the steps necessary to keep, your heart and yourself protected. And I know that a lot of people use fitness devices like Apple Watches and Fitbits. Are these something that, that you recommend, and what should we be looking out for when we are wearing them? I know I have one and I don't always necessarily know, I'm like, oh, is this okay? Am I doing all right?
I think it's like many other things. It's a good addition to have if you use properly, but it's not a substitute for the other basic things of exercise and diet. So if you have it, you can use it as an additional sort of marker for your activity level, but you have to be aware that just having it is not going to make you healthier.
That makes sense. And what, like I said, I do have one. I never really know, what the numbers mean. So what is a good resting heartbeat?
It's variable, but anything from 60 to 80. A true resting heart rate is fine, but it's not just one number. You have to check it multiple times, different situations, and it goes hand in hand with blood pressure and other parameters. So by itself, it's just a partial information. Use
it as an assistant, not as not as the only tool you have to check your heart.
Right.
So we talked a little bit about preventative measures. I want to get a little bit into risk factors. So, as a woman, does heart disease affect us differently? Is there, things we should be looking out for?
Right. No, there's this notion that women are less affected by heart disease than men. And that goes sort of back historically, and women were not used in studies as much as men were, but that's really not true. It turns out women are just as likely, unfortunately, to get heart disease if they have the risk factors. The number one killer for both men and women is still heart disease, and the risk factors are, of course, family history, diabetes, smoking, everybody knows that's a big one, and weight. These are the big risk factors that need to be addressed as best you can.
Sure. And if we do, find ourselves, with heart disease or, having some difficulties, are there any non-surgical options?
Right. There's there's many options before you end surgery, so the last option, but definitely there's medications that your cardiologist or primary care doctor can prescribe. The main ones are medications for lowering cholesterol and blood pressure medication. There's also blood thinners are sometimes used in some patients, such as aspirin, such as other kind of blood thinners. So those are the basic ones, but particular, patients have other medications they can use. If you have diabetes, control of diabetes is very important. Indirectly, you're preventing heart disease. So
eat healthy, exercise, all the things to read. Go see your doctor, get your checkups.
Right.
And if the problems, do persist and we have to end up to see someone like yourself, what are the best surgical options and some different things how to address our heart?
Sure. So before you get to surgery, there's the option of stents. And, most patients, if they do have a blockage in their arteries, will get a stent. But some have too many blockages or they've been stented before, then they need surgery. The most common surgery is bypass surgery, which is for blocked arteries. And that's where we use arteries or veins from other part of the body and connect them on the heart to bypass the blockage. It's a very common procedure. It's very routine nowadays, very low risk. The other surgeries that we do a lot are valve operations, either valve repair or valve replacement. So those two are the most important ones. Then there's less commonly aneurysms that are repaired. And as I said, AFib surgery is on the rise, and that number is going to grow.
And what separates Cooperman Barnabas for, in terms of cardiac care? What makes us stand out? We have you, of course. So
yeah. I think there's a couple of things. One is, first of all, there's a track record. As most people know, our results are public and published. Everybody can check them, and we compare very favorably to all the other programs in New Jersey. So that's the track record. On the other hand, I think the really positive thing about this program is that we offer the full spectrum of cardiac procedures. There's no need to be sent to some other center to take care of a particular thing, because we have the specialists within our own system to take care of it, whether it's bypass surgery, valves, minimally invasive procedures such as TAVR, catheter procedures, aneurysms, as I mentioned, AFib surgery. We have an aortic surgeon, that specializes in aortic surgery, so that, again, it's the aneurysms and related problems. And then all the way to the ultimate, which is, ventricular assist devices, and transplantation. We're the only transplant center in New Jersey. So I think that's really the big plus about our program, that we can take care of everything.
Yeah, we love that. We can take care of you no matter from start to finish. We've got you covered. Is there anything else that we should know and you want to add for us today?
No, I think we touched on everything. I think the main thing is being healthy and preventing. You want to, as much as I'd like to do surgery, I prefer if people don't end up requiring surgery, and it doesn't. Like we said earlier, you don't have to go exercise for hours or go on crazy diet. You just need diet is moderation, moderate exercise, see your doctor, and usually that will take care of most of the cases.
Take those simple steps. Yes, because we like seeing you, but like you said, we don't really want to see you. But again, everyone, that link, if you are looking for a doctor or if you have any questions, rwjbh.org/doctors. And if you have a question for Dr. Sardari, you can just drop us a comment and, he can answer, and we'll get back to you as soon as we can. And Dr. Sardari, thank you so much for being here today. I know that you're so busy, but we really do appreciate your time. And to everyone watching, thank you for tuning in, and we'll see you next time.
Thanks for your time.
Bye, everybody.